Welcome back. We're joined now by Texas Governor Greg Abbott, who is live from the state capitol in Austin. Governor, thank you for being with us on this Wednesday evening.
My pleasure. Thank you all.
Let's start with testing tonight. Right now in Texas, are there enough tests available for COVID-19? And are you afraid that not enough people are getting tested as we think about reopening the state?
Well, first, there's going to be two different levels and layers of testing. One is the type of testing that we've had so far. And the type of testing we've had so far is sufficient to identify all those who need to be identified, because the people we are most concerned about are those who are hospitalized and those who lose their lives. The good news is, even though we've lost way too many lives, Texas has one of the lowest, if not the lowest, death rate of any state in the United States, and on a per capita basis probably is the lowest state. We have a low and steady hospital rate. As a result, we've been able to open up our hospitals even more. That said, I'm working with a team of 4 doctors that are working on this testing and tracing format where we will have extensively more tests available to us around the entire state, so that we will be able to monitor our communities to make sure that we are able to identify whether or not there's any type of spread as a result of opening up. Also, very importantly, it's not as if we're going to open up everything all at once. It'll be a measured, slow, and rolling opening up of our economy.
Here in Central Texas, we've gotten a lot of viewer questions about church services. What should people expect as they return to worship this weekend? And would you recommend churches still do online or drive-up services for the time being?
Listen, the more that churches can provide services online, drive-up, or other strategies that ensure distancing is so important, especially for those who are age 65 and over with any type of health-based issues. We have found that, especially for those who are 70 and older, they're the ones the most likely to face the deadly consequences of COVID. So we want to do everything we can to prevent them from being exposed to COVID-19, knowing this: when you go to church or any other place, you have no idea whether or not a person sitting next to you may or may not have COVID-19. Hence, distancing practices are necessary wherever you may be, but especially in congregations like churches.
We've seen some larger urban areas say they're going to extend shelter-in-place orders through mid-May, perhaps even the end of May. What are you planning to announce in terms of a statewide plan?
We are working with this team of doctors to figure out what the best strategies are where we can safely open. And if we are able to arrive at these conclusions, then as early as next week, we will be announcing what's going to be happening statewide in the state of Texas, including the counties that want to try to close things down for a longer period of time, because our announcement will be based solely upon what the doctors say and what the data provides.
You know, some states are thinking about reopening as soon as Friday. Georgia comes to mind. They're also thinking about easing travel restrictions. Any idea on when we could see an easing of those restrictions here in Texas?
We will be looking at easing those, and we're talking to doctors about it. I will tell you, because this is kind of happening as we're speaking right now, I think there may be a reevaluation about what's going on in Georgia, because the approach in Georgia has not been well received by the White House and the advisors in the White House. And so there may not be as early of an opening as what some people were anticipating.
I know you announced that Friday a lot of retail establishments can start these retail to-go orders. How are you envisioning that going? What kind of response have you gotten from stores?
The stores are really excited about it, because they want this opportunity to begin to sell their products, and their customers want those products also. The way this works is exactly the way food to go has worked, and we've been able to do that without transmitting COVID-19. You know, you could go to a restaurant, you cannot go inside, but you've been able to order food from a restaurant and pick it up to go, or either have them deliver it. The same would pertain to retail to go. You can order a product online or by phone and go pick it up or have it delivered to you.
Governor, we appreciate the time and a few minutes on this Wednesday night.
My pleasure. Thank you.
Thank you.